Good day, I am Rivera from BSN1B. So today I'm going to start for the assessing the ears, the nose, the sinuses, the mouth and the throat of the patient. So first we are going to start for the ears, which is we are going to assess the client's history of his hearing loss, drainage, or any problems that are in the ears. And we are doing this because we need to know if there is any risk factors that are related to the ears of the patient. So now we are going to start for the assessment, which is we are going to ask the patient if there are any problems in her ears. So, ma'am, I am Rivera from Resident. So, ask ko lang po ma'am is meron pong mga problem po sa hearing loss po natin or like may marinig po kayo.
Wala man, wala.
So as our patient said, none, and that is a good assessment because there is no any problem for the ears of a patient. So next is we are going to inspect the patient's the ears of the patient's size, shape, the symmetry, the lesion, and any or the color of the ears of the patient. And we are doing this inspection because we need to know, we need to detect if there are any disease that are occurring to the ears of the patient. So we are going to inspect now the ears of the patient. So ma'am, inspect ko lang po yung ears niyo ha. So, as we inspect the ears of the patient, there is also no findings that there are any problem that are occurring for the ears of the patient, or there are lesions, or there are changes in the color and the shape also of the patient's ears is also symmetrically or equally. Next is we are going to palpate of the tenderness masses, the cartilage, the swelling, or the pain in the patient's ears. So we are doing this because we should note if there is if the ears of the patient is soft, non-tender, and also it should be no juice and no swelling, and also no pain. So we are going now to palpate the ears of the patient. So ma'am, palpate ko lang po yung ears niyo. If mag-sign po kayo sa akin if may pain kayo maramdaman po ma'am ha, and check ko na din po if may swelling. So the patient's response is none, and we find these findings that the patient's ears doesn't have any swelling, no pain, and also the cartilage of the patient's ears is also soft, and she doesn't feel any tenderness, so it is a normal finding for the ears. Next, we are going to perform is we are going to assess the hearing through the hearing of the patient through the whispers test. So we are doing this assessing of the hearing through the whispers test to the patient because we need to know we need to test the high tone, the low tone, and the sensory neural of the patient. So ma'am, mag-whisper test ako, tapos kung ano yung i-whisper ko is i-ano mo lang po ulitin mo. So
1, 2, 3.
okay, kabila naman po tayong ears ma'am. Sisipa.
1, 2, 3.
So the patient, I whispered the numbers 1, 2, 3 to the patient, and as the patient repeat the numbers correctly, it is assessment findings that the patient ears does have a it is in a normal finding because she heard the words clearly, and also we test the high tone, the low tone of the patient. It is a good findings or a normal finding. So next is we're going to perform for the lateralization, which is we are going to perform the Weber's test and the Rena's test for the patient. So I'm going to use a fork here since I don't have a tuning fork. So uh, assume that I have a tuning fork. So we are going to test the both ears of the patient in the both test. Oh, ma'am, mag-signal po kayo sa akin if marinig niyo po both ears yung vibration po, ma'am. If hindi, magsabi lang po kayo sa akin kung asan po yung may hearing loss or wala. Let's see. We are going to start for the Weber's test first.
Both ear.
Next we are going to test for the Renee's test. Next ears naman po natin. So we are done for the performing the lateralization to the patient, and we are done with the Weber and the Renee's test. So the patient's response is also both ears doesn't have any hearing loss or any problems to the test. So we find this assessment a normal finding and a good finding for the patient ears. So we are performing this test because we need to note or we need to check the lateralization of the ears of the patient to the vibrations of the tuning fork. So that's for the ears. What we're going to do is we're going to assessing the nose and the sinuses of the patient. So first thing we're going to do is we're going to assess the client's history of nasal congestion, nasal infection, colds, epistaxis, and any problems that occurred in her nose. And we are doing this assessment because we need to identify if the patient does have a child or adult problems that occurred in her nose, and also if there is any medication, if also there is a hospitalization and infectious disease that have been through her that had been through in the nose. And first is we're going to ask the patient history also. So ma'am, meron bang meron kang colds ngayon or ngayon ma'am? Wala po.
Wala man.
Mga blockage po sa drainage, ganun po.
Wala. Normal, ano lang, makahinga man ako.
Nakahinga ka ng maayos. Wala pong problem or any. Okay. So the patient response is none also. So the assessment findings to this is a normal finding because we didn't have occurred any problems that in her nose. Next is we are going to inspect the patient's nasal position, nasal mucosa, the color, the discharge, the flaring, or the patency of the patient's nose. So we are doing this inspection to the patient's nose because we need to determine the size, the shape, the symmetry of the nose if it is in a normal finding. So, ma'am, inspect ko lang po yung nose, sit lang po tayo ng proper and look straight po tayo sa akin po, ma'am. Inspect ko lang po mga So, as I inspect the patient's nose, as we did not find any abnormalities in the nose of the patient, the nasal mucosa of the patient is also in a normal color. The symmetry of the nose is also in a good shape or in a perfect shape for the nose, and also the size and the symmetry also for the patient. Next, we are going to do is we are going to inspect for the frontal and maxillary sinuses, by translumination. So we are going to turn off the lights later, and we are going to use the pen light to inspect the sinuses of the patient, the masses of the sinuses of the patient. So we are doing this inspection again for the patient because we need to know if there is an edema or any discoloration in the sinuses of the patient. So, ma'am, off ko lang po yung light, tapos check lang po natin yung sinuses po, ma'am, ha? Okay po. Ano po natin? Open po natin yung mouth natin, ma'am. We're done inspecting the masses of the sinuses of the patient. So, as I check the sinus of the patient, it give a red color, which is a normal finding for the sinuses. If the patient opens her mouth, we check the sinuses here in this part. So, the assessment finding for the sinuses of the patient by translumination is also a normal finding. Lastly, for the nose and sinuses for the patient is we are going to percuss the sinuses masses of the patient if there is any tenderness. So we are doing this percussion for the patient because we need to know if there is any discomfort for the patient's sinuses or any tenderness to the patient's sinuses. So, ma'am, i-percuss ko lang po yung sinuses. Dito lang po ako sa left side po ninyo. Mag-signal po kayo sa akin if may pain kayo maramdaman. Okay, sige po. Starting sa frontal po, ma'am.
Wala.
Okay. Next is...
Wala din.
Right po, ma'am. So, as we percuss the patient's sinuses, frontal and maxillary of the sinuses of the patient, we have come up in a assessment finding of a normal finding because the patient's response is she doesn't feel any tenderness to her sinuses. So that's for the nose and sinuses. The next thing we're going to assess, The next thing we're going to assess is we're going to assess for the mouth and throat of the patient. So first thing we are going to do is we're going to assess the client's history of mouth and throat problems, or there any sore throat, dental pain, or any pain that have occurred in her mouth and throat. So we are doing this assessment because we need to identify if there is any risk factors that are related to the mouth and throat, or any disease that are related to the mouth and throat. So we are going to ask the patient for her history of the mouth and throat. So, ma'am, meron kayong sore pain po ngayon?
Wala.
Dental pain po. Dental pain. Or mga singaw. Mga sugat sa gums. Wala din po.
Wala din.
So, okay lang po. Wala po kayong pains na maramdaman sa mouth and throat. Okay. So, the patient's response is none. So, we find this assessment finding a normal finding because the patient's response is none, which is good or a normal finding. Next, we're going to do is we're going to inspect the lips, the tongue, the gums, the oropharynx, if there is any texture, lesions, or bleeding in the mouth of our patient, and also the throat or the inside of the mouth, and that's all that we are going to inspect. So we are doing the inspection for the patient's mouth because we need to know if there is problem in the texture of the mouth, if there is also a bleeding, the lesions in the patient's mouth. So we are going to use a tongue depressor, which we have here, and we're going to ask the patient to open her mouth to inspect properly the mouth of the patient. So ma'am, inspect ko lang po muna ang lips po muna. We are going to inspect again the patient's mouth. we use this tongue depressor early, so we are going to dispose it in a proper area. Next is we're going to palpate the lips of the patient, or the lips, the tongue, or wait, tenderness again. Huh? Palpate po. Okay. Luto asa mo siya nali eh. Note if there is any tenderness.
Palpate kay. Sa gamay lang.
Tongue and muscle tone. Okay. Next, we are going to do is we are going to palpate the lips, the mouth, the tongue of the patient, or the muscle tone of the patient, the muscle tone of the tongue, the mouth of the patient, because we need we are doing this palpation because we need to know if there are any tenderness, and also if there are any tenderness that occurred as we palpate the patient's mouth, we should note that and report it, or assess that, note that we have a record. So we are going to use again a tongue depressor to use to palpate the tongue of the patient for any tenderness. So first, we are going to palpate the lips of the patient. So, ma'am, palpate po ako ng lips po, ma'am. Signal po kayo kung masakit po, ma'am. Sakit po. Okay. Ito yung paano po, ma'am. Sa tongue po natin, ma'am. Open po tayo ng mouth po. Signal po kayo kung masakit po. Okay, wala po, ma'am. Okay. Sa iba po, ma'am. Sakit po. And dispose it in a proper area because it is already used in the inside of the mouth of the patient. So next is we are going to stimulate. Next is we are going to stimulate the gag reflex of the patient. So we are doing this stimulation for the gag reflex of the patient because we know we need to identify if the patient does have an absence of the gag reflex in the inside of the neuro of the patient. So, ma'am, ano po ako ha, ipasok po yung tongue depressor po, tapos react po kayo kaagad if ano na po ha, sakit po. So, dispose it into a proper area, and we are done for the stimulation of the gag reflex of the patient. So, next thing we're going to do is we're going to assess for the taste acuity of the patient. So, to conduct this acuity taste is we are going to use a tongue depressor and put a little bit of sugar to know if the patient acuity taste is responding if the pain. Evaluate the activities of the patient. Terminological and problems. Next thing we are going to do is we are going to assess the acuity taste of the patient. We are assessing the acuity taste of the patient because we need to evaluate the neurological response of the patient if there is any problems in the cranial nerves or the frontal lobe of the patient. So to conduct the assessment is we're going to use a tongue depressor and also a little bit of sugar to know the acuity taste of the patient. So we're going to get a little bit of sugar using the tongue depressor. So ma'am, acuity taste na po tayo po, ma'am ha. So taste na po ninyo ang sugar.
Matamis.
So, the patient's response for the acuity taste, we use a sugar which is taste as sweet. So, the patient's response is a sweet also. So, it means the acuity taste or the assessment findings for this acuity taste of the patient is a normal finding due to the response of our patient. So we are done for the assessing of the ears, the nose, the sinuses, and the mouth.